So when I look at addiction, I look at it as a disease that affects the whole person. I think of their physical health, their mental health, their emotional health, and their spiritual health. When I think of the physical aspect of the disease, I always keep it simple and think about that physical craving once the addict puts the substance in their body. They have a real difficult time saying when they're going to stop using. And then we treat that obviously by detoxing the individual. And then I think about that mental aspect, which is that obsession. So even after their detox, the thought keeps coming back to them. And I think about that mental twist. So the addict has no evidence that it's a good idea to put this substance in their body, but somehow their mind talks them into it. And that last aspect of the mental component, I just think about it as that blank spot where the addict finds themselves using again, and it oftentimes happens where they're intoxicated and they weren't thinking about it, they weren't debating over it, it just happens. And then the third aspect of the disease, that's where I think of that emotional or spiritual aspect, and those are those thoughts and feelings that cause the addict to feel the need to put substances in their body. And I think that's really where the focus of our work is. So if I think about, what are those thoughts and feelings that cause the individual to use, those are the primary problem. That's what we're treating here. It's the actual substance use itself is just the expression of the problem. Another way that the model here differs is those thoughts and feelings that cause the individual to feel the need to put substances in their body. Those are also the thoughts and feelings that disconnect them from the people in their life. So our focus here is really identifying what is the root cause of the addiction, and then how do we start to change these thoughts and feelings to start to foster some more positive relationships.
I view addiction as chronic, ongoing, progressive, and deadly until treated. At Ohio Community Health, we've created a patient-centered model to be able to tackle all aspects of not only addiction, but also co-occurring mental health disorders, because you're going to be hard-pressed to struggle in addiction and not feel depression, anxiety, put yourself in traumatic situations. And being able to holistically treat the entire cause of the issue itself, but also coexisting issues, is going to do nothing but put that patient in the best possible scenario to be successful. So we use evidence-based treatment in a variety of different levels of care to ensure that we are treating the entirety of that individual and any struggles that they might be dealing with.